Good afternoon, everybody. Welcome to our webinar on the future of healthcare. We've got a very distinguished group of panelists who will come on to shortly, and Sunny will be moderating the event for the next hour or so. Just from my side, I am the chairman of the British Chamber of Commerce. I'm also the senior managing director of Michael Page across Indonesia, Philippines, and Singapore. So two different hats, but quite connected in this topic, where on the British Chamber side, we get to see where the investment is coming into the healthcare space, and from the Michael Page side, very much where the talent demands are, and the two are very much in synergy together. So a very active sector is what we are seeing, spanning from the more traditional hospitals and medical institutions, where there's due to COVID, and we're just saying that COVID tends to sort of come up in most webinars these days, but due to the pandemic, the demand for nurses and medical staff has been enormous over the last 2 years. Then through to the sort of the pharma companies, in terms of distribution, but also then really around the topic of today, that digital transformation, which is affecting and is an opportunity for everybody, which we're seeing with the more traditional businesses and the multinationals, as well as also the startup environment and ecosystem, which is becoming very interesting, particularly talking to the VC and PE firms who are either domestically or internationally looking to invest in the country. So in and around the healthcare, or the digital side of the healthcare space particularly. So really looking forward to hearing the comments from our panelists around this, because it's a subject that I know we talk a lot about at board level, both in the British Chamber, but also in Michael Page across the region as well. Just quickly on the professional women's group who are hosting this event, it remains, I believe, the only professional women's group out of any of the chambers in Indonesia. It's celebrated its 10-year anniversary last year, so it's a well-established group, chaired by Sunny, with some very key and influential individuals as part of it, who run multiple businesses in Indonesia, and have played a very key role in helping us really sort of keep professional women's group at the forefront of the pillars that we pursue as part of the chamber, in terms of the impact we're trying to make in both this country, but also creating that bridge to the UK for foreign investment as well. And I will just on that point just mention the mentor program that we've put together in the last 12 months, which is really using the expertise we have and the people we have on the board, particularly to enable female professionals coming through in their careers to maybe get a different voice, to have an opportunity to speak to people who've been through that journey and understand the ups and downs and the challenges and the tips and advice. So if you are interested in hearing more about the mentor program, I would strongly advise you to reach out to the chamber or to Sunny directly, and more than happy to, or myself, and very happy to go into more detail around that as well. To our speakers today, a very big thank you for giving your time to us. Ibu Windawati, Pak Varun, and Pat Jonathan. I'll leave Sunny to introduce you in more detail, but I know your businesses reasonably well, and I'm sure our audience is very much looking forward to hearing from all of you. And as we said earlier, if you have any questions, please do put them in the right area, and we will endeavour to go through as many of them as we possibly can throughout this presentation. So you don't want to hear from me for too much longer. I shall hand over to Sunny, and look forward to the rest of the webinar. Thank you very much.
Thank you very much, Ollie. And thank you, everybody, for joining us today. This is our first event for 2022. And I'm really excited because it's a topic that I think we all are eager to learn more about. It's a topic that many of us talk about. It's always in the forefront, especially in the last 2 years. And for those who are not familiar with BritCham Professional Women Group, this is our 11th year. We do events online and offline. And for this year, this is our first one, but we hope to do an event once every month. Yeah. And thanks to the core team of BritCham Professional Women Group, we decided to take up healthcare because we would really like to showcase what are the options available, both online and offline, what are the new digital advances in healthcare, and we hope through this session, you will be able to make better choices in the future, especially when it comes to such an important topic. Yeah, Indonesia is really in the forefront when it comes to online apps. And so our first speaker is Jonathan, who is the co-founder of HelloDoc. And Jonathan co-founded HelloDoc in 2016. When I Google anything to do with medicine, as I mentioned to Jonathan, the first name that comes up is HelloDoc, whether I'm Googling a name of a doctor or a medicine. And I'm really impressed with all the information that is available online. And HelloDoc currently connects 20,000 doctors, 4,000 pharmacies in over 100 cities, and they have partnered with Indonesia's largest lab to provide home care services. And HelloDoc is also the app that most people who are, as they say, isoman, self-isolating, and it is the most easy user-friendly app. So please, Jonathan, without further ado, please let us know what made you set this up, what are the advances you have made, and what is the future for HelloDoc and Indonesia. Thank you.
Thank you, Sunny, for a very kind words and kind introduction. So I'm very happy that I'm sharing this panel with a very great friend, Varun and Buinda, which I think we are all together here in fighting for a better healthcare in Indonesia. So a little bit about the story of HelloDoc. We started back then in 2016 because of a big calling of a default challenge of a country like Indonesia. We know that in Indonesia, we have one of the largest archipelago country in the world. We have about 17,000 islands and 74,000 villages. But I think we only have 3 doctors out of 10,000 population. So that was the first calling for us, where we realized that every one of us, every single audience that come to this event, BritCham of Commerce, every one of you all have a heart. But unfortunately, we only have 1,000 cardiologists to cover the whole country of Indonesia. So each cardiologist have to take care to 174,000 patients. With that, we were thinking, how can we be part of this solution for this default challenge of country like Indonesia? So that's where we come with technology in place back in 2016 to democratize this healthcare accessibility. That's where we start. We are not just a telemedicine company. We are a company who try to solve healthcare accessibility. And accessibility comes in many forms. It can come in the form of access. It can come in the form of administration. It can come in the form of capability to pay. That's why we are partnering with important partners here. We are working with 20,000 doctors. We are working with 4,000 pharmacists. We're working very closely with providers like Siloam and a few thousand other providers, because and when we are working very closely with payers like Astra Life and the likes of other insurance. So we are basically a platform that try to simplify access to healthcare by the use of technology. Now, when we started in 2016, we never imagined that the country will be the country healthcare system is going to go through a stress test like COVID in 2021, like the last few years that we had this pandemic. But we feel very fortunate that we built this platform way before. So when COVID comes, we can work together with all these partners to find solution that easily in place for COVID. So it's a great use case for us to actually provide this solution, from the ease of patient to talk to a doctor, to receive the medicine within 15 minutes, for them to pay it using their insurance like Astra Life, or to pay directly on their own pocket, or just to simply connect it to the closest PCR tests like in Siloam, or for them to come and to get vaccination as well. One of the big, I think one of my biggest, I think one of the big story of Indonesia today is today we have Omicron, and the Omicron case have passed Delta in terms of numbers on daily cases. But I don't think there is any negative situation. Medicines enough, hospitals is enough. It's because a collaboration between public and like the government and private organization, like the likes of telemedicine company like Halodoc, the likes of Siloam, the likes of Astra and other insurance together. And today we're happy to say that on a daily cases, 35% of population that is affected positive is actually being treated by telemedicine service, and for them to stay at home isoman, like what you say. And I'm very proud to say that the government of Indonesia actually pay for the medicine. I don't think there's any parts in the world where COVID patient stays at home, you do telemedicine, and you got the medicine sent to you, and all the medicine is actually being covered by the government. So it's not just the government tried to prevent COVID by having vaccination for the whole country. The government actually worked to solve or curative in solving COVID by the use of gotong royong, or that's a key word in Indonesia where everybody hold hands together to collaborate to solve a problem. So coming back to the question, where we are, we came from a situation where there is a default challenge of a country like Indonesia, but we try to use our fundamental core of Indonesia, which is gotong royong, which is togetherness. We partner together with the likes of his hospital like Siloam, insurance company like Astra, doctors and pharmacy to solve this problem. And the future of healthcare, we believe that the change of the situation of COVID basically push people to change dramatically the way they evaluate things. Among others are healthcare. They will always still going to go to hospital. Don't get me wrong. They will still need to go to hospital forever. But there are areas where they would prefer to optimize their healthcare experience. Among others are a simple appointment using the platform. Maybe for a very simple case, they might talk using telemedicine. Everything is paid by the insurance automatically, because everything in during this period, it's a learning period for people to understand that the use of technology is actually enable them to get a better healthcare experience without the hassle of the access. So I think that's my take on the situation and what I see for the future. Thanks, Sunny.
Thank you so much, Jonathan. And as I take on from what you say at the end, that actually technology is there to assist us to have a better experience, which leads us to our next speaker, Mr. Varun Khanna, who is, Varun is the Senior Director of Healthcare Business and Investments at Siloam Hospitals Group. And when I Googled, I found that Siloam has 40 hospitals, 23 clinics, a medical team of over 500 general practitioners, as well as 2,200 specialized doctors, 9,000 nurses, and support staff throughout Indonesia. That is really incredible. And Siloam is one of the leading healthcare centers in Indonesia. Let's hear more from Varun, as he is the growth-oriented business leader and digital business transformation leader for Siloam Group. Thank you, Varun.
Thank you, Sunny. Thanks for the opportunity. And I echo what Jonathan said. It's great to be on the panel with Jonathan and Buvinda. So let me try and take from where Jonathan's left. Essentially, last 2-3 years have done what probably the world would have achieved in 10 years on the digital health tech side, or actually health delivery side, right? A lot was happening around the globe, but I think this pandemic, for good or bad, I don't know, but I think largely for the good, as the pandemic is getting over, so I believe, catalyzed the entire transformation of health. And to a point that Jonathan said, access, I'd probably add a prefix to say, is probably making the world ready for equitable access, right? Especially Indonesia. Indonesia, in our business, while we love to keep it complicated, yeah, so that we don't get too many professionals coming into our industry, but it's not a very complicated world for us, right? There are, if I was to break my business, it's T and I, yeah, talent, technology, and infrastructure, right? Now, when you look at it, talent is the clinical talent that we have, of course, the administrative talent. Technology is all that Jonathan's spoken about, the front end aspect of it. And of course, then there is a lot that we do in terms of care, delivery, cure, right? And infrastructure. Now, in Indonesia, technology and infrastructure, technology is all bought. So we use the same Philips, the same Siemens, and same equipment that any other place in the world uses. Infrastructure is probably better than any other countries that I've known. And on the talent side, the access is an issue, right? Because he alluded to the numbers, 3 per 10,000 people, and so on and so forth. Now, how do you really create access for 279 million people? And I think that journey is being catalyzed for Indonesia by technology, and I guess on account of COVID. I draw a parallel for Indonesia. Indonesia is kind of skipping a credit card generation, yeah? It was a cash economy, skipped the credit card generation, and suddenly then we saw something called mobile wallets, right? And the penetration of mobile wallets in this country is significant. The same way, I'd say that healthcare will see this transformation in a very big way in Indonesia, providing access. Now, going beyond that, I think, and trying to answer your question, let me try and put 5 words across to you, yeah? Now, healthcare is really, from a touch point, quite complex. We have a discovery phase, which every business rather has. And let me define what discovery is for you so that you don't find these words too heavy. How do people discover us? Yeah, it's a word of mouth, social media, advertising, online search, through HelloDoc, webinars that we do. Then there is a stage called consideration, which is, they think that Siloam is the place to get to. So they would actually go through our website, our Siloam app. They would probably go through the insurance platforms, which we are embedded in. The third stage is the care stage, which is on-site hospitalization, a site of service like home care, teleconsult, labs, pharmacy delivery, and ambulatory care, which is, our drive-throughs, our skin clinics, our systematic clinics, weight management clinics, and so on and so forth. The fourth is the post-care aspect of it, where we have the patient portal, the care plan, the follow-up, the electronic records of the patient. And fifth is advocacy, which is health library, social media, cross-channel supports, etc. All of this is getting digitized. And this is easier said than done, trust me. Because pre-COVID, we would all imagine that we were working to digitize the discovery stage, which is quite obvious. We were trying to get in more patients, and therefore we wanted to bring the app, the website, but largely for discovery. Now, the entire piece post-COVID has changed. We are all looking at using these platforms to actually provide teleconsult, to provide, and Jonathan spoke about it, that is providing access. There is a patient portal. If you were to download a Siloam app today, you could do half the things yourself without connecting with anybody physically. You could book your appointment. You can walk into a hospital. You can look at your patient records, which in the pre-COVID era would not be accessible to you, right? They'll stay with the hospital forever. And because they are now digitized through the EMR, they're also available for any other provider to use. So if Jonathan is collecting your health information, when his platform would send a patient to us, you don't have to do the form filling again. You don't have to go through the whole rigmarole again. The administrative process is much simpler. And same thing with insurance, because on how technology is embedding insurance platforms and health platforms together, the administrative issues of you getting a claim approval, you then looking at discharge times, which could well be in excess of 5 hours, and you're sitting wanting to go home. All of that is getting better. So beyond that, I think there are a couple of other pieces that I'd like to touch upon, which are core healthcare pieces. Some of you may just want to hear it while they're complex. We've also seen that because of COVID, while the front end is getting digitized, we've spoken about it, the care protocols are also getting digitized. Now, the advancements on account of artificial intelligence, let me give you a few examples. In Indonesia, we say, and if there are any doctors on the platform, don't kill me, but we say there is a cliff in terms of clinical talent. Yeah, the best is as good as anywhere else in the world. But as we go remote into the islands, clinical talent, it's a problem, so to say. Now, today, technology permits embedding something like a clinical decision support system for a GP while he's consulting with the patient to provide and look it up on a clinical platform to say the advice that he's giving or the protocol that he's asking the patient to follow is actually validated through a technological platform, what we call CDSS. Then the world is evolving on smart medical imaging. It is evolving on disease prediction models, which are all AI run. Let me sign out with one very futuristic piece that is happening, globally. You've always heard of this concept called twins, right? We had brothers and sisters who were twins. Imagine a world, and it may sound a little sci-fi, but imagine a world where you have a digital twin, right? What's a digital twin? Just to explain a little better, it is the representation of your body digitally, right? Today, if you were to practice healthcare as has been happening over the years, if you were, let's say there's a patient who has cancer, yeah. Today, the cancer treatment will go through on the patient. Now, you've always heard of this concept called side effects, drug doses too high, drug doses too less, cancer didn't kind of get cured properly. Imagine a digital twin where the cancer dose could be digitally given to the digital twin. The exact impact of the dose could be seen digitally. And once the digital twin has got cured, you could actually repeat the same protocol on the actual patient. Imagine how the world will improve in terms of outcomes. So that's where we are. It's a term that we use, metaverse. The world is progressing towards it. And I do see that the digital interventions on account of cure will make our world a healthier place.
Thank you so much, Varun. And thank you. I mean, I am really excited to hear about this digital twin. And I think it's going to be wonderful if we can actually test something digitally before it is administered. That would be really, really amazing. And I hope that this will happen soon. Yeah. Now we will go next, but last but not least, our woman panelist to join me, Ibu Winda, who is from Astra Life Insurance. Winda has 27 years experience in the insurance industry. And she joined Astra Life as finance director in 2014, and she became the CEO in 2020. When I Googled Astra Life, I found that their tagline is "Love life, enjoy today, dare to dream, and make it a reality." So Ibu Winda, please share with us the dream you have with Astra Life for everybody in Indonesia. Thank you.
Okay, thank you, Sonny. I guess, in Astra Life, I think we have been starting our journey since 2014 to fulfill the dream of Indonesian people. I think we are trying to, provide the peace of mind, be in everybody's home in Indonesia. So hopefully we're still fulfilling their dreams in our next journey. But I think back to our journey so far in 2014, I think our dreams and our aspirations so far, I think, is quite challenging, especially during this pandemic. We find it actually the situations during the pandemic, starting in 2020, is actually there is a good and bad in a way. I think the good things, I think the pandemic is actually accelerate our dream in a way to first, of course, to provide the protection for a lot of people here. Yeah, I think we can see that the pandemic itself, I think, is creating needs for the Indonesian people to actually aware of the life insurance. Yeah, I think we have quite amazed in what we have been experienced during the pandemic. Yeah, I think I know that we don't want to flashback what we have experienced back in the pandemic, but I just want to actually show that during this pandemic, I think there's this positivity in terms of the needs of protecting your loved ones. I think this is the way that Astra Life has been doing this insurance business, I think, yeah, to help everybody. I keep saying to my team that actually we are in the very good industry. We actually pray for everybody every day, so you don't get sick, you don't die. I think you still protect your loved ones. Yeah, I think that's a very good business. I think we pray for everybody. Yeah, I think so. During this pandemic, I think we have seen that people are getting more aware of that. Yeah, I think maybe the sickness, or that's creating a reality of what actually is going to happen. Yeah, this pandemic is going to happen. Yeah, anyway, now or I think in the next few years there will be another pandemic. Yeah, so I think it's always repeated, but we are being prepared, I think, with that. As I mentioned, this situation is actually accelerate our needs to actually be able to serve the customers. Yeah. So during these 2 years, Astra Life has been doing quite a lot in terms of initiative. In terms of the digital initiative, is actually, I think there's a lot of collaborations. I think with Halodoc, and also a lot of our providers. Yeah, we have been doing a lot of collaboration initiative. Basically, what we have seen, the telemedicine, I think, is been very helpful. I think we know that we never think about that. I think in the maybe when we start Astra Life. Yeah, I think now we see that it's actually very helpful. First, I think for Astra Life itself, yeah, for me, I can see that it's actually help in terms of our costs. Yeah, in terms of our provider or health costs. And we know that in the healthcare, cost is a very high, I think, in terms of healthcare costs. It's always a challenge for insurance industry in terms how we can actually managing this. Yeah, we don't want to charge too much, but we know that actually the medical care cost is actually always increasing more than the inflation itself. Yes, so it's a challenge that we have been experienced during this journey. Yeah, but we also understand that in the insurance industry now, we actually been tested, and then we actually know that we actually be able to fulfill our services and promises to our clients. Yeah, we know that in the health business, for example, we have actually in Astra Life, we provided a variety of product, yeah, catering all the segments, yeah, and also we catering all the needs of customers. So we don't actually only have the healthcare or health insurance product, but we also have a lot of life insurance product that also protecting the wealth of the customers. Yeah. So, but back to the health, we actually also try to actually provide the easier way or touch point in terms of customer buying. I think we know that in the traditional way, the life insurance is sold, yeah, it's not bought. So it's people try to push, yeah, to sell. So we know that used to agency and bank insurance is the main channel, yeah, to sell this life insurance product. But nowadays we can see actually the tractions of product insurance products sold through the digital platform. Yeah, so we have a lot of collaboration also in Astra Life. We have a collaboration with Traveloka as well. We have also collaboration with, of course, the group within the Astra itself. Yeah. So we know that currently in the last 1 year, actually the tractions of people buying through the insurance product in our digital platform is actually increasing quite a lot. But again, yeah, the journey is not that very easy. It's accelerated because we can see actually the pandemic accelerated the needs of the customer to buy this insurance product. Yeah, so I think hopefully, this awareness is not dying down, yeah, after the pandemic. So people have to see that there's a real need to have the insurance to protect your loved ones.
Thank you, Ibu Winda. And I agree with you. And I hope that through this platform, and especially with everything going digital, that people will be able to access insurance in a more seamless way and access better healthcare because they have insurance, because that will empower them in making their choices. And we have a lot of questions. So without further ado, I will open the floor. And I see on the Q&A that there are a few questions. Please rest assured, if we do not manage to touch on your question, we will connect and send that question to the panelists via email, and then we will get back to you with the response. So please bear with us. We have a limited time, and this is such an interesting topic. So the first one that I would like to ask is about the, this is from Tifa, and she says that there are many, many improvements on health deliveries, especially in the future of the healthcare era. What styles of care workers and enthusiasts will be needed to contribute in the near future? And somebody else also asked a similar question in the sense of, will there be new jobs created because of this digital and this overlap between digital and offline healthcare? And will there be people who may lose their jobs as well? Would Jonathan and Varun please care to elaborate on this?
Varun, you want to go first?
Sure thing. Thanks, Jonathan. So it's a very interesting question, and actually the response does not sit with what has already happened. It sits in what is going to happen or what are the trends that we are seeing globally. Let me just try and understand. This is Buthifa, right?
Yes.
So Buthifa, let me frame my sentence. Healthcare is getting unbundled globally, and let me try and define this term, unbundled, Buthifa. Historically, everything sat in a hospital. Historically, there was no Hello Doc. Insurance came into being in Indonesia and actually grew in the last 10 years, right? Everything used to happen in a hospital, right? From maternity to cancer care in the same premise, right? There was no concept of ambulatory care. There was no concept of daycare. And today you would have heard these terms, yeah? Ambulatory care, daycare centers, radiotherapy centers, radiology centers, dialysis centers, birthing centers, right? Standalone laboratories. And this is where the market is going. Now, if you look at healthcare, today the healthcare penetration in Indonesia is a huge concern. The healthcare spend in Indonesia, huge concern again. With all of these models evolving and the healthcare getting unbundled, the care will become much easier, much more affordable, and much more accessible. And when anything like this happens to the industry, there's only one thing that can happen, and that is growth. So if growth was to happen, of course, there'll be more jobs created, there'll be more infrastructure set up, digital as well as physical. And I don't think there is any stopping for that as far as Indonesia is concerned. There's a long, long, long way to go before Indonesia can consider itself self-sufficient on health both from a spend standpoint, a digital infra standpoint, and a clinical infra standpoint. So that's the way I'd see it. Jonathan, over to you.
Thanks, Varun. I think Varun have a very interesting view about unbundling healthcare and how it reached to growth. The question is I think is a very valid question with regards to job. Varun just now gave a very great example of ambulatory care. In the past, a lot of people would not imagine how a nurse or a doctor will have to adapt managing a patient at home or managing deliveries of other services at the other place of convenience in a drive-through service. In which, if we think of that job description 3 years ago, that job description never exists. So I think one thing that I can answer is that the care or healthcare itself will require healthcare practitioner forever. So there is always going to be a need of healthcare practitioner, maybe on a different kind of models, but technology will, in my opinion, will not disrupt the importance of the healthcare practitioner itself. Now, what technology will bring is what I call accessibility, because I think the enemy of healthcare itself is the administration, the paperwork, the waiting time, and whatnot. That is the part where technology will basically help to enable. Now, there will be some areas of job that will be moved or changed on that particular aspect, because then the key focus of the providers will be on the healthcare itself rather than managing the administration. Varun mentioned just now on his talk that the 5 points of healthcare discovery, consideration, care stage, post-care advocacy, 70% of them you can get it in the application of Siloam, for example. That means that all the administration of those 5 parts is technically self-administered, in which technology have take place. So I think to answer that question, I think we should be very optimistic in the job creation rather than job loss because of technology in the healthcare space. I know in other vertical of technology, it might actually impact in a negative way. I don't think it's impacting in a negative way in healthcare. That's my view.
Thank you. And Ibu Winda, would you like to add, what about job creation in the insurance line? Is there a tendency that you will require less insurance sellers, or are you selling policies online as well?
Yeah, I think in life insurance, as I mentioned before, I think is not going to be in the very near future that people will, go directly buying online. I think there's certain life insurance product that in nature is quite complex, right? I think we need people to actually explain it, come to you, and then, explaining a lot of benefits, especially the health insurance, there's a lot of things regarding the illnesses that need to be explained. Yeah, I think is quite complex. Yeah, but the digital part can help us actually to sell a product that is quite simple. Yeah, say it's protection based, or even the hospital or health insurance product that actually simple in nature. It can help actually to complement, the products that already sell through the BPJS, for example. Yeah, I think there's different segment that we can tap into. Yeah, offline and online.
Thank you. Yes. Now we have an interesting question, which is asking, what is the measurement for normal life with COVID in the future of Indonesia, especially given the huge gap between urban and rural living standards? So what do you think is the measurement for normal life post-COVID, with COVID, in the future of Indonesia, given the huge gap between urban and rural living styles? Who would like to go first?
Winda, ladies first.
Thanks, Jonathan. I think what is the measurement for normal life with COVID. I think it's quite the same, I think, with other diseases, right? I think we treat COVID because COVID just come, suddenly into our lives, and then like we don't have to prepare like just some other, illness. I think in Indonesia, I think we have experienced quite a lot actually illnesses similar to this, right? We have dengue, we have typhoid, a lot of things are actually happening in Indonesia. Yeah. So what I said is that what we need to do is basically is to socialize with the people the importance of the preventions. I think that's what we can do. I think how we can treat for example now the distance. Yeah, for example, we actually don't used to like sitting far to each other. In Indonesia, we try, I think most in Asia, yeah, we like to hang out, So now suddenly we have to, distancing ourselves from our family, from our friends. Yeah, I think it's like a big step in to avoid or to prevent the COVID. But I think this is gonna be a few years. Yeah, I think we have to be a lot of socialization, reminder to people, and I think people will get used to it. I think not mentioning between even the people in urban and rural. I think we need to keep actually applying the protocol, and then the health protocol I think should be implemented, for everybody. It's not for rich. I think for everybody have to be socialized and then reminder. I think what the government does, I think is a very good because the reminder is been, like every day, So I think people now already like get used to it.
Thank you, Ibu Winda. Yes.
Varun?
Yeah, so it's a very interesting question, and there cannot be a forum these days without the COVID pandemic discussion. Yeah, so even if it is future of healthcare, we got to discuss COVID. So I think it's a very interesting question. I don't know if I'm capable enough to answer what's the measure, but I'll tell you a very good way of looking at the pandemic. Right. And there's something interesting. Yeah, we've had a pandemic like this, or a pandemic 100 years back, which was quite similar, more disastrous in terms of loss of life, but quite similar. Yeah. So it's and it is a documented history. There are three stages of a pandemic like this. The first stage is what we call hibernation. Right. You don't have a choice but to duck it. Right. And we need to learn this concept of hibernation from maybe animals. All right. When the first wave came in, we were not prepared. We were not ready. We did not have the infrastructure. The only way you could avoid it is hibernate, lock yourself down. And that's what governments across the world did. Now, that's no different from hibernation, by the way. We did not get under a tree, but the concept of hibernation was stay home, don't get out, and ensure that the spread is contained. Yeah. Phase one. What is phase two? Phase two is what we call preventive, and this is what Bhuvinda also spoke about. And preventive has three categories, so to say. One is personal protection, which is what we call PPE in our parlance, which could be a mask for you, which could be a gown for the healthcare worker, and which could be an N95 and a deep protection suite for someone who's, catering to a infected patient in the ICU, right? The second part of preventive is social distancing. You got to manage through social distancing. And the third and the most critical part, and Jonathan alluded to that earlier, is vaccination, right? That is really the preventive side of it. And that's the phase we are going through currently, yeah? We are all in a preventive stage. We've all got vaccinated. We all realize that this version of Omicron, version that we call Omicron, has been less deadlier than what we saw the previous two versions being. And the third, and a little bit, adding a little bit optimism here, is there is a cure version as well. That's the third stage, yeah? Hibernation, prevention, and cure. Now, that's not far. Sooner than later, we'll have the cure, right? So it'll become a common cold for you then. One, the resistance levels in our body will go up. Two, we would have got a flu shot for whatever it's worth. And three, we'll be comfortable saying that, okay, there is a pill available if I have it, right? So that's how complete normalcy will come back. Till then, I think one thing that we've known that through the phase of these 2 years, every passing quarter, our life has become more normal than the previous one. So I think that's the way I'd see the measure. Don't have anything beyond that. Thank you.
Thank you.
Jonathan, yeah, back to you.
Well, I have a very intelligent speakers who basically have spoken the answer of that very question. I think I'm not going to repeat what these two very intelligent speakers speak. I think my only point is that I think just like 9/11, where people before 9/11 we don't feel comfortable of being bomb search or go through those measures in the airport. Today, we have a different types of this situation where information is what matters. Now, Peduli Lindungi is the largest application of healthcare application in the world today, in which basically is to basically notify people information, whether you already get tested, whether you already get vaccine, and for you to actually come into a mall and whatnot. Who would have imagined that all of us now will adhere into a situation that if you want to come to a mall, you have to give your information. So I think I would say that the measure of post-COVID is how information is being transmitted between people. In the past, information is very much just between very selected parties. I think in the future, information will be very transparent in that regards. So the manifestation of that would be in many forms, whether it's electronic medical records, whether it's claim policies, whether it's whether you're healthy, whether you are infected, maybe no longer COVID, but maybe we're talking about, do you have, I don't know, other flu symptoms and whatnot. And people are just basically say, oh, you have this flu, let's not have a meeting, and so on, right? But the way it's going to be manifested, whether it become in your Peduli Lindungi apps or in your Halodoc apps or in your Siloam apps or your insurance apps, I think it's something that we just don't know. But I think information and transparency will be part of our future that going to stay for long. That's my take.
Thank you very much for that very detailed answer. And I think the conclusion is that for the future and now, we all are living with apps, right? There is nowhere you go that you don't need to open an app or something to do with an app on your mobile. And today, I think it's very different world. You cannot even enter a mall if you don't have a mobile phone that is enabled with an app. So I think digitally, this is where we are going, where everything is accessible in your mobile. And those who haven't caught on, they have to get on the platform as soon as possible, or they will be left behind. There's a very good question from Mr. Jeff Parker, which actually ties in with all your answers. It's on the Q&A, so you can read it as well. He's saying that my question is, how do you think the advancement of digital health and the realization of its promise depends on governments, the national and provincial, related to a national consistent approach to key standards for data interoperability, etc., and also necessary infrastructure, the messaging, security, terminology, how engaged and committed is the government in making sure that all these platforms are progressing? Please, can you help to answer this question? I think Varun addressed it earlier when he said that it's talent, technology, and infrastructure. So now they're being asked about the infrastructure part of this.
Varun, you want to start since it's your key?
So Jeff, it's It's a topic for our next discussion, certainly. It'll take 2 hours to answer if I was to go through every thing that you've asked, and I can see the detail in your question. Let me try and address a few parts, and I'll leave the government aspect of it to Jonathan and Bhuvinda. But let me take the health aspect of it. See, first of all, I think you're so right that none of this can happen unless the whole system comes into place. But there's about Indonesia, there are 3 things that I've seen in the last few years that I've been here. I've been here only 3 years. One, it's got one of the finest universal health systems, right? For whatever it's worth, BPJS with its kind of penetration and the affordability and the commitment that it has towards the population is phenomenal. I've seen developing nations. No developing nation can actually say that they've got 88% of their population covered under a universal health scheme. Kudos to the government. Now, you could argue whether that's good enough. You could argue whether that's that can take care of everything, whether that provides best-in-class care and so on and so forth. They can continue to argue that, but I'm sure every passing decade this will get better and better. The second aspect of it, and the example that was just spoken about by Jonathan as well, Peduli Lungi, Peduli the app, phenomenal again. Now, in the most developed countries, you'll see this happening. Sonny, you're right. You can't enter a mall without that app, right? And that app has everything configured into this. And also the way the ecosystem has been working, this is not a country where the government can pride itself having infrastructure to be able to deliver vaccination to 279 people. Absolutely not. But the government's will to do it and collaboration with various partners, and it did not matter who. Sometimes I've seen government collaborating with non-healthcare partners to deliver healthcare in this country. I think that will has been phenomenal again. I've seen many developed countries struggling. After the first quarter or two, I think Indonesia caught up extremely well, right? And that's all because of the will and the ecosystem they've been able to put together. I think another part of the question that I want to touch upon that Jeff has got is data. And he's spoken about key standards and consistency in terms of approach. I think that's something that the world is struggling with, Jeff. And I would say that I don't think those standards have been laid out very clearly in Indonesia as well. At some point in time, I think the world has to move towards interoperability and integration. And this is not limited to providers. This is not limited to payers. This is not limited to the government. It will actually start from your wearables itself, right? If you find time, just go through our app and see what we've done. We've created a platform called Diabisa, right? It is the first platform in the region, really, which allows you to manage your diabetes. Now, in isolation, that platform is good for nothing. If it was only Siloam and a Siloam few customers using it. But if you imagine that could potentially lead to diabetes data coming together for the country, I think it'll be very powerful. So some of that needs to happen, but I'm sure there is will, and maybe Jonathan can add more, but I'm sure the step is in the right direction.
Thanks, Varun. I think I'm just going to add a little bit. I mean, the question itself, it's an hour topic of its own, so it's a very good topic. But I think in short, the way I look at it, a year and a half ago, people were very skeptical about Indonesia able to vaccinate the country, let alone about what is Peduli Lindungi and everything. They basically said Indonesia can only vaccinate the country in 10 years. But the reality is today we have enough capacity even for the booster. So I think the government of Indonesia today is very progressive. Again, I'm not because I'm in the telemedicine business, but I am as an Indonesian, I'm a proud Indonesian to say that how the government is approaching public-private partnership in approaching in try to solve a stress test like COVID is one of its own. So I think the willingness of the government is there. The practicality of execution is there. And again, as a developing country, we are basically has the largest application user in the world to get a person and get to the mall. So in my opinion, today, as I'm interacting very closely with them, I know that all that's the question that was asked by Jeff is already being addressed by the government, which I cannot speak on their behalf. But I think I am quite comfortable to say that they are addressing all of that and they are executing it rather than just making, what do you call it, a nice paper, I would say.
Yeah, maybe just another point that comes to my mind, Jonathan, Sony, that I'd like to add. I think the willingness is quite evident in how they've decided to be the pair. Jonathan alluded to this earlier. Where on the planet are you seeing any government funding medication when you're sitting at home for COVID, right? That is willingness to a different level. I think really the Indonesian government has done things that seemingly looked impossible 2 years back with the way they've collaborated. I think it's been phenomenal. And also, if you look at Indonesia's health spend, that is something that is getting better, right? It's kind of doubled over the last decade. And I'm sure going forward, that's one piece that will get addressed. And as that happens, Indonesian health systems will get better. And maybe the job question also gets answered automatically. If the health systems are going to get better, there'll certainly be more jobs for people in the health sector.
Thank you, Jonathan and Varun. Would you like to add anything, Rinda, before we go to the last question?
Just a little bit. I think Varun and Jonathan already explained quite a lot. But I think for me, in terms of, I think there's some room for improvement. I think in terms of collaboration between the government and the private sectors. I think in terms of insurance sectors, in terms of, for example, the coordination of benefit, the BPJS and the insurance industry, and also the exchanging of informations, in terms of customer information that can help actually industry to see to use it wisely, of course, to get the benefits from the insurance part.
Yes, thank you. So I think this very nicely brings us to the final question. There's a lot of questions on insurance, Ibu Winda, but because I'm assuming they're all of a very personal nature, we will send them to you and you can see it on the chat. And please feel free to respond directly. We will give you the email connections. And this is a final question from Gabby Pribadi. She's saying that she wonders if any improvement in education development for nurses and other medical specialist assistants has been planned in the near future. It is very important for the development of healthcare to reach the international level. And I think education is very important. So Varun, can you please share your personal insight on this?
Sorry. Sure. So I'm looking at the question, Gabby. I think your question is the answer itself. Yeah, there's certainly a lot that is required to be done in this space on education, both on nursing and the clinical side as well. I would argue it's the entire ecosystem that needs to get better because the need is far outweighing the supply, right? So our industry is no different. If you allow me the liberty of calling this an industry, there is supply where there is the wellness and the curative aspect of patients that needs to be dealt with, and then there is there's demand, and then the second part is supply. Now, supply has two elements that we generally look at. One is the sheer numbers, right? And I think it's been discussed in the early part. On sheer numbers, also we fall short as a country. And then is the quality aspect of it, which you've alluded to. And I would again concur with you. There's a lot that needs to be done. Now, what is happening in bits and pieces. A lot of us are working towards it. For instance, I'm not sure if you know that we set up a state-of-the-art nursing college in Indonesia, in Karawaci, where we graduate 500 odd nurses every year. And then we set up something that we call the Siloam Training Center, which is a dedicated clinician and clinical training center. It is all managed digitally. Right now, when you have 13,000 nurses in your own system, and then you have to deploy the same solution for many other hospitals, it is difficult to reach out to them physically. And of course, the pandemic has made it even worse. So we were lucky, a little ahead of time, that Ceylon Training Center could actually start to train a lot of nurses, start to ensure that they were trained on specific areas of development, like ICU, like dialysis, etc. And I think that's a big step, and we are growing that as well. Third, and this is a point where I don't have a solution yet, but certainly there is a problem, is how do we develop the clinical talent further, both in terms of quantum and quality? Now, there is a old debate that Bhuvinda can add to. She's known this market more than I have. Should a foreign doctor be allowed to practice in Indonesia? Is the government willing to do that? Does it make life difficult for the clinicians here, or in the longer scheme of things, it makes life better? Because if you bring in a specialist, the idea would be that you can learn from the specialist from anywhere. We've all done that. We all go to foreign schools to study, to pick up the best practices from there. So that's something which is still under consideration, I would imagine. But would it benefit Indonesia as a country? Would it benefit Indonesians? The answer to that is a big yes. If we could bring in foreign doctors who could then help train and make the system evolve beyond where it is today. So that would be my response. I'll probably pass it on to Bhuvinda to add on to this.
I think Varun knows more than me regarding the talents in this health industry, but I think we are all aware. I think there's always a need for these health practitioners. Yeah, I think we know that everybody, especially the upmarket segments, like to go to Singapore, or Malaysia to do this checkup. Yeah, I think that's why the doctors, I think what Varun mentioned, I think was also is very important for Indonesian. I think not only, I think I agree, not only the quantity, but it's also quality. I think this one, what I think we need that in Indonesia.
Thank you so much, and I think this has really brought us to a very full circle with our topic, that the future of Indonesia is definitely, a collaboration between all these areas, between the digital app, the online administration, the offline care, the inpatient care at the hospitals, and then of course nicely supported by insurance in order to pay for the inpatient and outpatient services. And then, of course, collaborating with the government, where all of this can tie up nicely with all these apps, the Peduli Lindungi, Hello Doc. I mean, Indonesia is definitely on the forefront when it comes to apps. With Gojek, Tokopedia, Hello Doc, it is really amazing. So we should be proud of that. We should really be very optimistic about the future. And collaboration is key here, where everything can be tied up nicely and everybody can benefit in the future. And it is also really good, as Varun also mentioned and Jonathan shared, it's really good to know that the government is actually helping to pay for the healthcare for those who can't afford it, those who have COVID, and even if they use the HelloDoc app, they are actually being able to be subsidized. And that is really amazing. So together we can grow better. Let's make it a future where we are all better informed and we care for one another. Because one thing that I see that actually hinders our cure when we are not well is fear. And this is where technology, education, information can help us, because with the right information and the right doctor, we can be cured. And so there is always hope. And let's overcome fear with faith in the future, faith in healthcare, and faith in Indonesia. Thank you so much, everyone. We look forward to seeing you again at our next webinar. Thank you to the speakers, Varun and Linda. Would you like to say any final words before we say goodbye?
I think okay, maybe me first.
Yes.
I think I want to thanks for the opportunity. I think thank you, Sony. So hopefully I'm also happy can share my experience as well in life insurance. So hopefully we can all bring us the best for our Indonesians, yeah, for insurance and healthcare, uh, to actually overcome this pandemic together. Thank you.
Thank you.
Sorry, thank you. Thanks to BritCham for the opportunity. We really enjoyed having this conversation with you and fellow panelists. So with that, stay safe, and that's critical.
Thank you. Thank you so much, everyone. Thank you for your time, your attention, and for being part of this webinar today. I would like to thank the entire events team of BritCham, without whom this event wouldn't be possible. Thank you to Chris Wren, the director of BritCham, Ollie, the chairman, and of course, the core team of BritCham Professional Women Group, who are the board members as well as myself. I thank you all. BritCham has been an amazing platform for me, myself, to learn, to grow, to experiment with new ideas. And our women's group, the aim is to elevate and connect women in business. And we hope that through these sessions, we are actually helping you to make more connections and learn more. Let's grow and share with one another. And our next event is in March. We will be celebrating International Women's Day, and we will be sending you the information soon. We are open to new members. We are open to sponsors. If you would like to have more information, please do contact me or the BritCham team. Thank you so much and goodbye, everyone.